Welcome, everyone, and thanks for joining us. Today, we're diving into one of the most important health conversations happening right now, metabolic health. I'm Jennifer Chrisman, Senior Manager of Nutrition and Wellness, and I'm thrilled to be joined by Dr. Holly Lofton, Director of the Medical Weight Management Program at NYU Langone Health, and a member of our Scientific Advisory Board. We're going to unpack what's really driving the rise in metabolic dysfunction, what clinicians are seeing, and the signs people should be paying attention to. So let's jump in. Dr. Lofton, I'd love to learn more about you and how you got into this field.
Thanks, Jen. I really have passion for medical weight management and overall health. And I'm a board certified obesity medicine specialist. And I'm also trained as an internist. So like your regular primary doctor, but I really specialize in people getting their best body composition, which means maintaining lean muscle mass and getting rid of fat. I consider the fat cell to be an inflammatory gland that can get too large, and that's a condition we call obesity. And the goal is to help that shrink so that we don't have disease and morbidity related to fat cell size. And I can tell you the reason I chose this field is that I have childhood obesity. I consider it to be in remission. And when I was about 11 years old, I actually went to a community-based weight loss program with my mother. And I said, Mom, we're really not eating this way that they say. Let's try to do it this summer. And the previous school year, I tried out for the cheerleading team. I made the team, was really excited. I got fitted for my uniform. And over that summer, I lost an amount of weight that I'm not even aware of because I wasn't weighing myself. I'm 11 years old, but I could tell that I lost weight. And so could the students and teachers when I went back. The feeling I had of how different the social interaction I had with other people was something that really changed my life. And so I dedicated my life to helping, one, keep myself in that position, but also help others feel that way. And then as I became older and more educated with medicine, I realized, well, the benefits of my health for this are such that I want other people to have those health benefits and for my own good as well. So I really see all my patients as my comrades in this weight management and metabolic health journey. And I let them know that so I can tell them I've been in their shoes and we have to constantly evolve our plan to get the best outcome.
It's very relatable. Thank you for sharing.
Sure.
From your point of view, what is metabolic dysfunction and when does it start?
Well, I'm really excited to talk about this topic today because even the community of medical doctors are new to the concept of metabolic health and metabolic dysfunction. So when we break this down, what we're really looking at is how does our bodies as an overall being have either good health or dysfunction, which is poor health. So we're looking at how do our vessels work? Are our vessels clean? Are they full of fat or cholesterol? How are our organs? Do our organs have fat around them? Are they not functioning well because of that? And how do people just generally feel as far as energy, the ability to exercise? And ultimately, when you have more metabolic health, you have a longer, healthier life.
Oh, that's awesome. We all want that for everyone, right? So with the metabolic dysfunction, what are some of the earliest signs that someone's metabolism might be out of balance?
Patients come in to my office a lot of time and say, I went to my regular doctor and I told him I just don't feel well. I feel like I'm gaining weight. I feel really tired. But when they check my labs, nothing was wrong. And this can be one of the first signs of metabolic dysfunction, a general fatigue, malaise, we call it. Really being tired, even though you're sleeping. And this can happen in the setting of normal labs. So this is when we start trying to optimize lifestyle to improve those symptoms before labs become abnormal.
Okay, so someone might have come in and they look good, their labs look good, but they might not be feeling their best. And that could be unexplained. So that might be metabolic dysfunction.
Yes, sometimes patients tell me, I just don't feel like myself and I want to get back to that. And then we really work toward that being the goal more than, say, a number on the scale or any lab change.
Okay, great. So what does metabolic health look like then?
Someone who's metabolically healthy has good exposure to sunlight. They have a lot of energy. They're able to get through their activities of daily living, as we call them, and not feel as if they're run down. They may have less hunger than someone who's not metabolically healthy and fewer cravings than someone who's not metabolically healthy. So these are some of the signs that someone is metabolically healthy. And again, it doesn't have to do with any lab abnormalities because these are signs that come from inflammation in the body. And inflammation is really hard to track with labs. There can be chronic inflammation for years before any lab abnormality shows up. So that inflammatory state is really what we're trying to treat to maintain the metabolic health.
Yes. So someone that might be experiencing some of those mood changes or fatigue, like you were talking about, someone with good metabolic health will have the opposite experience.
Exactly, yeah.
So let's move on to talk about body composition and weight. So when we're talking about body composition, what is body composition and how does that impact metabolic health?
Again, Jen, I'm so glad we're talking about this topic. I've been measuring body composition in my office for almost 2 decades. And what we're really looking at is for the individual who's in front of me, how much fat mass do they have? How much lean muscle mass do they have? How much water are they carrying in their body? Because all of these numbers come together to determine what we call is your metabolism, which medically we consider the energy expenditure. How much energy does it take for your body to run? And it's better to have a higher lean muscle mass and a lower fat mass to keep yourself in a faster metabolism. If the fat cell starts to dominate, then the metabolism drops, and that can lead to rapid weight gain and ultimately disease and death.
Got it. Got it. So that balance between lean mass and fat mass, that is super important. So when we're talking about visceral fat, that's one component that you would measure. What role does visceral fat play in driving metabolic dysfunction? And why is visceral fat different from other types of fat in the body?
So to break this down, I'll give you a little lesson in nomenclature. So visceral means organs, and the fat that is visceral is the fat around the organs. So let's say a heart, for example. If you have fat that's surrounding your heart, it can't beat as well. That will lead to blood pressure problems, circulation problems, and ultimately that can lead to heart failure. Same thing with the liver, kidneys, other organs. So the fat that we lose that's around the organs is one of the most important types of fat we want to get rid of. And that's why people can lose weight sometimes and say, I don't feel like my pants are fitting differently, but that's a great sign because you've lost some fat around organs that was causing dysfunction. And as I like to say, your organs are happier that you lost this weight, that you made these changes to get that fat from around them so they can be nice, glistening, well-functioning organs.
We want those organs to be functioning, right? My liver, my kidney, all of those vital organs right around that area.
Yes.
That's awesome. And that can really help your metabolism, right? As if you're getting that fat and reducing it around the organs.
Yes. Because all of our organs have a function. That's why they're there. Our kidneys are filtering, our liver is getting rid of toxins, our heart is pumping blood, our brain is helping our neurological function, and we have pancreas and other things like that. So if one organ is dysfunctional because it has a lot of fat, that can lead to a trickle down effect that the person doesn't feel well, and the other organs eventually start to get affected as well.
So it seems kind of like you have some visceral fat and inflammation and all that kind of compounds to help, against you on your metabolic function.
And these are things that in a medical setting, we don't instinctively just test. We don't look at everyone's liver and kidneys with ultrasounds unless something's wrong.
Sure.
And by the time we've done that, there could be decades of damage. So I really take that first sign of fatigue, malaise, mood changes, cravings as something that tells me this is inflammation that's causing metabolic dysfunction that we need to treat urgently before we have a problem decades or years later.
So when we're looking at people's daily habits and what they're doing to help their metabolic function, I think of things like movement, resistance training, eating high quality protein. How does this play a role in protecting that lean mass and muscle?
We have to think about the foods that we eat and how easily the body can turn it into either energy or fat. So a lot of the ultra processed foods, things that come in a bag or a box that are probably very tasty, but also addictive, these easily get converted into sugar. And when there's too much of it, it gets converted into fat. So these foods go straight into fat. Whereas if we have, say, vegetables that are high fiber, it takes a lot of energy to make those into ATP, which is our energy. But thus we use a lot of effort and we help our metabolism by eating those foods. So if we have a very low fiber potato chip, for example. That easily gets converted into sugar and then fat. Whereas if we have a high fiber vegetable like broccoli, it takes energy, our metabolism, what we call the thermic effect of food, to take that broccoli and turn it into usable energy. So it takes a lot of energy to make energy out of that, and that's what keeps our fat cells down. So that's something that is really important, the quality of the food that we're eating.
Yeah. And that fiber is so important. As a dietitian, I'm all about helping my clients make sure they're getting enough fiber in every day. So many benefits, definitely. So, if someone wants to improve their metabolic health, what would you say are the most important nutrition and lifestyle principles to follow?
I think you stated already. One is movement. And I love that you said movement and not the gym.
Yeah.
Because so many people take it, I don't want to join the gym. I joined, but I didn't go and I don't have time. But if you do more activity than you're doing now, that is more movement. Find what's fun for you. Do it for the time that you have. And, I generally recommend 150 minutes a week of something that has you huffing and puffing. But you could break that up however you like. You could do 15 minutes 10 times. If you have 30 minutes to do it 5 times, that works. But these short bursts of energy are really beneficial for our organs to get our blood pumping, to increase our oxygenation and help us metabolize the food that we eat.
That really helps with your heart health too, getting that exercise in. What's your favorite exercise to do, Dr. Lofton?
Yeah, so cardiovascular health, that's what you're talking about. I really like to walk.
Yep.
And if it's nice enough, I'll take that to a jog.
Yeah.
Walking a lot.
That's great. Yeah. That's great. Yep. And anybody can get out there and take a walk, right? That's awesome. So let's shift gears to talk a little bit about GLP-1s. Anything that you're seeing from a patient perspective and patients taking GLP-1s that they are not focusing on, whether it's their nutrition or movement? What's happening in that world?
Well, I tell patients when we start a GLP-1 that these are a tool that we'll use in addition to lifestyle, in addition to nutrition, to activity, to behavioral change, to get the best metabolic result for them. And I tell them as we start the medication, it's important that you really do your best with those components to get the best result. The medications are usually titrated up over about a 5 to 6 month period. And in the trials and in clinical practice, we see the most weight loss in the first 6 to 8 months. And I inform patients, this is your window to do the best that you can. Because after this time, the weight will come off slowly. But if you don't do your best in that period of time, you may not get the optimal result. And then you'll maintain, but at a higher weight, which means a higher weight, higher fat mass, which means more inflammation. So we really want to focus on using this as a tool in that first 6 to 8 months to get the fat cells to shrink, because that's what's going to be the determinant of your long-term health and longevity.
And with that, if one of your patients, let's say they're on the GLP-1s and then they don't focus on those lifestyle habits and getting all of those habits in line, what do you see happening with them?
Well, for patients who really rely on the drug solely for their treatment plan, we don't always see the improvements in the metabolic factors. So we may even see weight loss because some people may respond very well to the medications, but their LDL cholesterol is not going down. Their blood pressure is not going down because they're still eating, say, high sodium foods, but just fewer of them. The fatigue may not improve. And also with GLP-1s, if you're not eating the right thing, you will get sick.
Yeah.
So we see more side effects if patients aren't really following those lifestyle recommendations.
Okay, so it's really important for them to focus on getting that proper nutrition and those lifestyle changes.
Absolutely. Okay. And also another side effect people have if they're not following the dietary is constipation. So if not having high fiber foods and you're taking GLP-1, a lot of constipation, which can lead to discontinuation of the drug because it's just not tolerable. And ultimately, the whole thing just doesn't work.
Yeah. And then along with that, hydration is important, right?
Of course.
With the constipation. And then nobody wants to feel constipated. That's uncomfortable.
Exactly.
To piggyback on that, what risks do people face if they're losing weight too quickly on the GLP-1s and maybe not focusing on the lifestyle? Do you see impacts to like muscle or lean mass or anything like that?
If someone's taking a GLP-1 and not really trying to optimize the diet, I see these people present more with things like headaches, fatigue, a dizzy feeling. Because what happens is even with the GLP-1, your glucose can go up and then down, and that makes you feel slightly hypoglycemic. So people feel a little like they're going to pass out, or they don't feel well in the sun because they're not hydrating. So these are things that we really try to stress the importance of while taking the GLP-1. The other thing is the rate of weight loss is not so much the problem, but how you lost the weight. So if you lost 5 pounds this month and you were doing everything that we recommended, I'd be okay with that. But if you lost 5 pounds this month and you only drank broth, that would not be ideal because you're losing a lot of muscle mass with that. And that's not the goal. We want to maintain the lean muscle. We want to lose the inflammatory fat that causes metabolic dysfunction. And those are our goals.
Okay, great. Yeah. And then, making sure you're getting that high quality protein, to help, maintain that lean mass is so important.
Right. And I will just say that as a vegetarian for over 30 years, I know how hard it is to get protein.
Yes.
And we really emphasize at least 60 grams of protein for patients taking GLP-1. So we give them individual protein goals based on their ideal weight and their starting weight. And even if they are vegetarian, there are supplements we recommend for protein that are really high quality and really breaking down how much protein they're getting at each meal because they can't eat that much at once.
Yeah.
You have to have little spurts of protein throughout the day to meet 60 grams.
Yeah.
And if they're not able to meet that, we do think about things like lowering the dose. But I really try to emphasize how patients can get protein in, even with dietary restrictions or intolerances.
And the amount I can imagine too. So when you have a patient on GLP-1, obviously their appetite is suppressed. So you want to get that high quality protein in a smaller amount.
Yes.
Right. Dr. Lofton, can you tell us a story about maybe a patient that you've had that you've seen metabolic dysfunction and how that has come about?
Well, as we're talking about metabolic dysfunction, our audience is probably thinking, oh, these are people walking around, they're sluggish, they look like they're really overweight, I'm going up past them on the stairs. But a patient I actually had who surprisingly had metabolic dysfunction was referred to me by this gentleman's wife who was a doctor. And she said, I really want you to see my husband. I'm so concerned that he's very sick. I said, let's rush and get him right in. Gentleman came in. He's in his 30s, male, South Asian descent. And his weight was medically normal. His waist circumference was a little bit higher than what we considered normal. But he did give us a diet recall that was very full of ultra processed foods. We're talking pizza, ice cream, fried foods. And I was surprised by his diet. When we got his labs, he had the highest triglyceride level I've ever seen.
Oh, wow.
His triglyceride level was over 500. So when it's that high,
that's concerning.
Yes. The lab actually cannot calculate LDL cholesterol. So we don't know what is LDL cholesterol because there's so much triglycerides in the blood. And we're triglycerides. Triglycerides are fats circulating in the blood. This gentleman had so much triglycerides circulating that his blood actually was white when they drew it. So we're thinking this is a normal looking guy walking down the street, not the huffing, puffing person you need to pass on the stairs. But he was a metabolic disaster. Wow. His labs weren't great. We really changed his diet. He was ready for it. His wife participated in an overhaul, got him on the high quality protein, got him exercising, got him hydrating. And within 3 months, these all normalized.
Wow.
Yes. And not even with the goal of a lot of weight loss because he did not need to lose weight, but just really getting the best lifestyle, maintaining that lifestyle and constantly reevaluating how can I maintain this? So once we get metabolic health, you have to maintain it for the rest of our lives. And that plan will change over time. It's important to have someone on your side to help you adapt your plan as your body changes as we age.
Yeah, that's so important. That community of support and helping somebody when maybe they're struggling, maybe they've started a lifestyle program and they need that support. Community is so important. So if you had a patient so that's a very powerful story. Thank you, Dr. Lofton, for that. And just a few short months, he made major improvements.
Yes.
That's incredible. So if you had a patient come to you today, right now, what is maybe the number one or two thing you would tell them to do, to implement, to improve their metabolic health?
One thing I think it's important for people to know that metabolic health can be changed. Metabolic dysfunction is a reversible process. And so the first step would be to take inventory of your current lifestyle. Be honest about how much you sleep, how much you're eating and drinking, what your activity is. And then we can work together to make small changes to create that overhaul that in a year, your lifestyle looks totally different, but you don't feel as if you're suffering.
Yeah.
And that will be the best first step so that we can get the optimization of the metabolic health.
And it's a process, right?
Yes.
It doesn't happen overnight, but you make small changes. You have a community of people helping you, and that's really can make a huge impact. Dr. Lofton, thank you for sharing your expertise and helping break down such a complex and important topic. And thanks to all of you for tuning in. Conversations like this are essential as we continue raising awareness about metabolic health and empowering people with better information. We hope today's discussion gave you clarity, confidence, and a few takeaways you can use in your own health journey. Thanks again for watching. We'll see you next time.